Welcome to Neurology News Network. I'm Jenna Pasco.
And I'm Matt Hoffman. Let's get into the news from this week. The American Headache Society released its position on the integration of the newly approved preventive migraine therapies into clinical practice, with the goal of providing guidance to the healthcare professionals who will encounter them. The guidance laid out a set of 5 circumstances which must be met in order to use the CGRP monoclonal antibodies, including that is prescribed by a licensed medical provider to a patient who is at least 18 years of age with a diagnosis of migraine with or without aura, according to the ICHD-3. As well, the patient must have failed 6 weeks of at least 2 therapies and have at least moderate disability as defined by a MIDA score of greater than 11 or a HIT-6 score of greater than 50.
Eisai has announced the submission of an NDA to the FDA for Lemborexant for treatment of insomnia. The NDA is backed by results of 2 phase 3 clinical trials, Sunrise 1 and Sunrise 2, which enrolled roughly 2,000 participants, in addition to important safety studies such as the assessment of postural stability after awakening in the middle of the night and a next morning driving study. The full data from the 12-month Sunrise 2 trial will be presented at upcoming medical meetings this year.
A research team at the University of Rhode Island will be undertaking a phase 1 clinical trial evaluating the effects of dabigatran, known commercially as Pradaxa, on the vascular system's role in Alzheimer's disease. Dabigatran, a direct thrombin inhibitor, is currently indicated for the reduction of the risk of stroke and systemic embolism in patients with non-vascular AFib, and the treatment and prevention of deep venous thrombosis and pulmonary embolism. Results of that trial are expected to read out in late 2020.
In a conversation with Neurology Live, Dr. Paula E. Voinescu, an attending neurologist at Brigham and Women's Hospital, spoke about how seizure frequency during pregnancy and postpartum varies by epilepsy type. She shared some insight gained from a study of seizure frequency in pregnancy and postpartum. Let's take a look.
Since 2013 until 2018, we have tracked over 100 pregnancies, more precisely 114 pregnancies. Among these pregnancies, we noticed that, as it has been reported previously in the literature, patients with focal epilepsy are doing worse compared to patients with generalized epilepsy. So that was not a new finding. But prior publications have not looked at the localization of the seizure onset zone to see whether that was important in further stratifying this risk of seizure worsening during pregnancy. We showed that within our patient populations, the women with focal epilepsies have a higher risk, but also women with frontal lobe epilepsy have a significantly higher risk even within the focal epilepsy group.
For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.